Good evening, my dear students. Today we are discussing about one of the topic, mental illness. So, mental illness it is related to the a mental health condition that has a negative effects on the way on individual. So, it related to the nervous system simply. So, what is the mental illness? Mental illness means it is a biological disorder. The brain dispute a person thinking, feelings, moods, ability, and any other characters. So these are the characters are developed in the body, that is called as a mental illness. Means thinking, negative thoughts, negative feels, and irritation, behavioral irritations. This type of characters is developed in the body, that is considered as a mental illness. So mental illness, it is occurred in our body. It is a mental illness causes. What are their causes? Mental illness causes. Just check the point. So first one is it is a antisocial attitude. They are not mingle with others, and a lack of education, poor employment history, lack of social time, and family and mental related factors, and family or marital factors, and substance abuse, antisocial friends and peers. These are the few points related to them. These are the points are it causes the mental illness. And the mental illness is developed by not only our body, surrounding environment also creates some disturbance in our body, right? So arguments and like that, so it creates some irritation in the nervous system, that is also considered as a mental illness. So risk factors, mental illness risk factor, just check this point. So first of all, we mentioned the some points related to the risk factors. First one is a genetical factor, biological factor, and the lifestyle and the environmentals also creates some disturbance. For example, traits that inherited from the families. Genetically is the presence in our body, that is a compulsory presence. Biological means due to the imbalancement of chemicals and the pattern of the cell communication, this one is also creates a disturbance. And the next one, lifestyle, poor diet means not healthy diet, and then substance abuse, lack of exercise. Just compare that early morning 6 o'clock, 4:35 to 6 o'clock, up to 6 o'clock. So our body is means morning 6 o'clock up to 6 o'clock, body is participates in any physical activities, so entire day is very active compared than other persons. Same like that. So lack of exercise and irregular sleeping pattern, irregular every day 8 hours compulsory sleeping. So due to that also some disturbance is created in the nervous system. And one more is the environmental factors. In environmental factors, so few factors is mentioned. Check that. First one is exposed to the sudden loss, violence, abuse, neglect, and low economic status, unsafe communities. These are the problems. Environmental problems also creates a mental disturbance in the body. So now we'll discuss about the mental illness etiology. So total three different types of etiologies are there. Just check this. First one is the biological factors, psychological factors, and social factors. Biological factors, first one is the heredity. So in case in our body chromosomal abnormal characters are transferred from one generation to another generation, this type of problems is developed in the body. And a disturbance of neurotransmission means calcium channels is going to block, depolarization repolarization processes are any disturbance, and dopamine level decreases or increases, this type of problem. And brain damage due to the physically and psychological changes, physical illness, these are the problems are creates some disturbance in the body, it leads to the mental illness. So now we'll discuss about psychological problems are mentioned. First one is the so strained interpersonal relationship, stress and frustration, pathological personalities, and childhood insecurities. These are the psychologically they are depressed, psychologically they are exposed to the anything, so that one is also creates some illness. And social factors means poverty, poverty, economically weak, and alcohol consumption patients, and urbanization, family instability, unemployment. These are the factors, are the social related factors. These factors also sometimes affect on the nervous system related pattern. Abnormal patterns is developed, that is called as a mental illness. So total five different types of classes are there related to the mental illness. So first one is the mood disorder. Our mood is a perfect, so mental. The next one is the anxiety, and the next one eating disorders, and the next one dementia, and the next one schizophrenia. These are the five major problems or causes the mental illness in our body. We know very well about these five major classes. Just check that. So now we'll go discuss about signs and symptoms. So signs and symptoms, first one is too much sleep or trouble sleeping. Just to go with this. And the next one, trouble focusing on having reaching the thoughts, and changing in aptis. And the next one, like this, some characters is mentioned. These are the signs and symptoms. Simply abnormal behavior, and mood is unstable, and they are alone only, they are not mingle with others. These are the signs and symptoms. They are the suffer from the abnormal characters, especially mental illness. There are a lot of signs and symptoms are there, not only these five, four, a lot of signs and symptoms are there. You go with that. Okay. So now we'll discuss about prevention. So prevention is the total three different types of preventations are there: primary, secondary, and tertiary. First of all, we'll focus on the primary prevention. So primary prevention here. So first of all, problem solving technique, and life skill approach, and de-stress exercise, and good interpersonal relationships, and good parenting skills. These are the provided to that type of patients. And here mention the mention especially this type of characters is developed in it's one of the reason is a poor background also, and as well as unemployment also. These are the primary preventations or provide this type of activities, or this type of suggestion, this type of characters is maintained in the particular patient. The patient is recovered from that type of problem. This is the primary. Now we'll go with the secondary. So secondary here, just check this. In primary, some problems are there. What are their problems? So first one is these are the hectic life schedule and the secondary life schedule, and these are the risk factors identification, and how to controls by the meditation and regular activities, exercise, and these are the some points is mentioned. In case they are the loneliness, just suggest the pro-social behavior, and the media illness, and the next one the neurological imbalance, go with this one, and any other drug addiction, go with the de-addiction process. And a lot of reasons are there. Patient suffered from mental illness, is suffered from the mental illness due to the which reason. So that reasons are how to controls, that is the primary process. Okay. So now we'll go with the secondary process. So in secondary prevention, first one is the early diagnosis. So early diagnosis, screening the screening. So first of all, screening which problems, screening the programs in school, universities, industries, and whatever it may be, etc., etc. Early diagnosis mental illness, and screening the substance the abuse disorders, and pay attention to warning signs. Get routine medical checkup, and then don't hesitate of ask for help, or whatever it may be. These are the early diagnosis. What is the treatment? Pharmacological treatment. So first one is the pharmacological drugs related treatment, mental illness drugs related treatment, and psychotherapy, and group therapy, and these are the behavioral therapy, and they are the some therapies are suggest to the patient. Patient is slowly come back to the normal position from the mental illness. This is the secondary. So here what are their warning symptoms? So in cases we observe the some characters like confused, and seeing hearing things are which is not there, and selection is not perfectly. And the next one, anxious, find hard to sleep and sleep more than usuals, and change in the school performance and hyperactivities, and self-injected injuries, surgical means they are suicidal thoughts. And these type of suicidal thoughts hanging like that thoughts is develops. And abnormal behavior, aggression behavior, this type of characters is developed in the body in the secondary. So now we'll go with the tertiary prevention. So tertiary prevention, first of all, family support, to suggest the family support. And the next one, then the next one, complicate towards long term medication, suggest the pharmacological drugs. And in case patient is suffered from the mental illness due to the any addicted drugs like alcohol consumption, morphine, codeine, heroin, at the time de-addiction is suggested, then after counseling. So this is the tertiary prevention. So total three different types of preventations are there: primary, secondary, and tertiary. And then go with the rehabilitation. In the rehabilitation, so first one, so communicate residential service and workplace accommodations, social and family support compulsory. And the next one, employment support to the employment, and some characters is suggested. So the rehabilitation patient is a recovery from the mental illness problems by the rehabilitation techniques. Okay, so these are the services are there: early diagnosis treatment, rehabilitation, group and individual psychotherapy, mental health educations, different types. So simply, person suffered from the mental illness due to the which reason, first of all identify that, and that is a primary. What is the secondary? Suggest the drugs. What is the tertiary? Support it. Right. So these are the primary, secondary, tertiary treatments for the mental illness. So this is about our today topic, and tomorrow we'll go with the one more topic. Thank you.